Hello and welcome. I'm so happy you've made it this far. I'm Lara and I work for aBaby SA. My job is incredibly rewarding because every day we bring the weight of a wish of love and of hope to infertile parents. You're about to start an incredible journey, a rewarding process that may just be the most important thing you do in this lifetime. It's not hard, but it does need your commitment. Our aBaby SA dandelion stands for all that is good in our worldwide egg donation program, releasing dozens of seeds representing fertility and abundance. I'd like to tell you a bit more about why it's so crucial that we give professional services to the special groups with whom we work, recipients, donors and clinics. We have plenty of experience in managing the process of egg donation, and at the end of the day, it's about a successful pregnancy, and you are the key to this rewarding experience, not us. We say that dandelions thrive under the most adverse conditions. For future parents, who we call recipients, it's been a hard path, filled with failed IVFs, expenses, heartbreak and emotional seesawing. They desperately want positive results, and you can make that happen. As an egg donor, you'll join our team of special people, all local and all carefully selected, to make sure that our recipients have the best possible chance of achieving their dream of a family. aBaby SA is not a medical facility, but a service to South Africa's best fertility clinics and their patients. We work with the best specialists in reproductive medicine to keep you safe while donating and to make you comfortable with a crucial role that you play in this fabulous environment. The clinics do the reproductive medicine, helping couples to fall pregnant, while we focus on properly screened, high-quality donors and coordination services. By splitting up responsibilities, everybody can play a special part in getting to a positive result. That is, a pregnancy for our recipient couples. Fertility clinics refer patients that need egg donors to aBaby SA, and we help them find a donor that matches their criteria. We recruit and manage donors for this purpose, which is where you come in. For us, it's all about results. For you, it's all about results. That's what we call a successful match. As a donor, you are incredibly important, not just because of your donation, but also in that you're committing time and love, caring and effort to a process that will bring joy and fulfillment to humankind. We know and appreciate this, and we in turn are dedicated to looking after you throughout the egg donation cycle. You will have only the best medical contacts and treatment, and we are there to hold your hand and support you to be the best donor you possibly can be. We know you're going to enjoy this experience. It's very special. So let's see how you get ready to become an egg donor. Now that you've passed our pre-checks and we know that you're suitable to become an egg donor, we'll finalize your portfolio and list you on our anonymous database for selection by our recipients. Your web portfolio will include a photo of you as a child and a nickname to protect your identity, as recipients are not allowed to know your real name. Once you're on our database of donors, it does take some time before you will be chosen by a recipient. It could take 5 hours, 5 weeks, 5 months. But what is important is that you're there for your recipient to find you. The exact time is out of our hands, but it's not a competition. A normal healthy body mass index is good because it makes hormone therapy more predictable. Your physical look is important, as recipients generally lean towards choosing a donor with a similar appearance, so hair and eye color may be important or not. Your shared interests may be important or not. Parents fancy intelligence and good health. Who doesn't? So family genetics do play a crucial role. Your personality profile is usually important. Recipients are looking for a personality that resonates with them, so a one-liner personality description won't get you very far. We want you to paint a full picture of yourself in a few paragraphs. Your profile is always open for you to edit, so if you think your personality profile needs sprucing up, do it today. Now that you've committed to our program, and you could be chosen at any time, you should live as healthy a lifestyle as possible, which includes a balanced diet, exercise, and other healthy lifestyle choices. We'll stay in touch with you regularly while you are waiting, so that we know about any changes from your side that may affect your availability as a donor. We understand that your life goes on, so to keep up with you, we like to email you every couple of months. We also monitor the activity on your profile. If your profile doesn't attract many inquiries, we look at what can be done to improve matters and work with you to update information or to make your portfolio more interesting. The South African Medical Ethics Committee recommend the rates we pay to you per donation cycle. This is an inconvenience allowance for the time and energy you expend on gifting your eggs to help parents with their dream of having children. The money is paid in cash by your clinic on the day of the egg retrieval, after you've completed the program. Our website will always have the latest rates listed. Eggs are not sold, they are gifted, and no price can be put on that gift. Your recipient parents will never forget you. They're investing a lot in you, both financially and emotionally, and we rely on you to be reliable and responsible and fully committed to a successful pregnancy. You must stick to all instructions you are given by your doctor while on the program. Recipients also cover your medical costs relating to your donation process, so you will not pay for doctors, evaluations, blood tests, or medical prescriptions as part of your donation. Now, let's look at what actually happens during the egg donation cycle. Only registered recipients may view our donor profiles, and once you're selected, we'll contact you immediately to confirm that you're available, and the donation process starts within a week of you being chosen. You are needed for 8 to 10 weeks, not all the time, but there are a few critical steps that we will discuss now. The first phase is the medical screening and the assessment, which covers the first 2 weeks of the program and consists of 2 one-hour appointments. These appointments are all about making sure that you are medically and emotionally fit to donate. The first appointment is with a fertility specialist assigned to your donation, and is primarily to ascertain your health and fertility, to make sure that your ovaries are healthy and that you're generally fit and medically suitable to donate. Part of the examination will be a scan done by vaginal ultrasound, which is not painful and lasts only a few minutes. The doctor will also do a few blood tests for, amongst others, HIV, hepatitis B and C, syphilis and cytomegalovirus. Then we wait a few days for the results, which the doctor will discuss with you, and that's it. As we said, there's also a 1-hour psychological evaluation done by the practicing psychologist at the fertility clinic, which concentrates on the implications of egg donation, whether it's in your best interests and how your unique personality could handle the program. It's quite fun. Although it's a professional assessment, you will certainly have an opportunity to learn more about yourself and what makes you tick. The clinic will ask you to sign a consent form, which is a legal document to protect your rights as a donor, as well as the rights of your recipient as the future parent. The agreement sets your anonymity in stone and confirms that you will have no responsibility for or claim on the child that may be born as a result of your egg donation. Right, now that you've been given the green light, we go into the next 4 weeks of the program. The second phase of the egg donation cycle is all about synchronizing your menstrual cycle with that of the recipient. What does this mean? Well, simply the recipient's body must be ready to receive your donated eggs, and for this she must be at the same point in her ovulation cycle as where your eggs left your cycle. Otherwise her body will reject the eggs. A date is set for the actual egg donation retrieval, which can only be set once your cycles are properly synchronized. The fertility clinic uses the pill to coordinate your cycle with that of your recipient. If you're not on the pill already, you'll be prescribed one suitable to you, which you will start when you get your next period. If you're already on the pill, you will continue as usual until the clinic gives you further instructions. The prescribed pill medication will be planned at your first appointment, and it's very, very important that you stick to the routine that is prescribed for you. All okay so far? Remember that our website has plenty of detailed information to flesh out this tutorial. Have a look at the donor frequently asked questions, as well as the detailed information about the egg donation cycle, or drop us a line with any queries. Now we need to discuss dates for your donation. Exciting times! Once your cycles are synchronized, a date will be set that suits both you and your recipient for the retrieval, and the fertility medication will commence to coincide with that date. Once the retrieval date is set and the fertility treatment has started, this date cannot be changed. This brings us to the third phase of the program, a 2-week treatment of fertility medication, designed to prepare you to donate on the date set for the retrieval, also known as ovum pickup, OPU, and again, it's super important that you follow all the instructions from the clinic. The fertility medication is in the form of daily injections, which you'll give yourself over a period of 10 days. Refer to the link on our website to view the step-by-step guide on how to administer the medication. Don't worry ladies, it's really easy. You'll have a proper meeting with the clinic to collect your fertility medication and to get full instructions on how to use it. The medication contains a follicle-stimulating hormone, which helps you to produce multiple eggs, usually around 10, which will go on to mature and be released for retrieval. The side effects of this medication are minimal and at worst will manifest in the same way as PMS. Your doctor will schedule 2 to 3 vaginal ultrasound scans over the 10 days while you're on this medication. They use these scans to check that you are reacting properly to the medication and to see how many eggs your ovaries are producing. The dosages will be adjusted to your unique requirements, so it's absolutely critical to attend these scans. If you are working, you'll need to schedule an hour out of your working day, plus travel time to the clinic and back. The clinic generally do their best to accommodate your schedule within reason. They're open for scan appointments weekdays and Saturday mornings, and they can arrange doctor's notes for one or all of your visits if necessary. Finally, we get to the fourth phase, the egg retrieval, also known as OPU, and transfer to your recipient. This is what it's all about, and we know that by now you'll be enjoying your incredible journey. Your ultrasounds have allowed the doctor to check follicle size, which means that they know exactly when your eggs are mature. The OPU is then scheduled to take your eggs out on the day of retrieval. This is the only day that you'll have to take off, because the retrieval is usually scheduled in the morning and finishes around midday when you'll be discharged. The procedure is done under mild anesthetic called a twilight anesthetic, and the doctors retrieve the eggs by vaginal ultrasound guided aspiration, so there's no cutting or stitching. Guided by the ultrasound scan, the doctor can position the needle precisely into each follicle for aspiration or suction. The eggs are released and collected in a test tube and then taken straight to the laboratory to be fertilized with the recipient partner's sperm. An ideal retrieval consists of around 8 to 10 eggs. The retrieval takes roughly 15 minutes, and after the retrieval, you will rest in the recovery room at the clinic while undergoing observation for about an hour, and then you'll be allowed to go home, where you'll probably want to sleep a bit or go slow for the rest of the day. Take it easy for at least a few days. The same as with any medical procedure, your doctor will tell you exactly what he expects after the retrieval, and you must have someone to drive you home after the procedure, as you will have been under anesthetic and feeling drowsy. What happens to all my eggs, you may wonder, after all of this? After fertilization and observation by the embryologist in the laboratory, which takes around 3 to 5 days, they will select the best 4-celled embryos for transfer to your recipient. 2 embryos are usually transferred at the doctor's discretion. As with any medical procedure, there are risks. Our professional partners will discuss these properly with you at your first clinic visit. You have probably heard of the risk ovarian hyperstimulation syndrome. This is the main risk associated with egg donation, occurring in 1% of in vitro fertilization cases. If you fall into the unlucky 1%, once the hormone treatment starts, your ovaries may start producing too many eggs. The symptoms of ovarian hyperstimulation would only manifest around the time of the egg retrieval, when you would start to feel ill, mainly in the form of severe bloating and abdominal pain. You have all the necessary cell numbers and would be expected to let the clinic know immediately. Treatment is usually a bit more bed rest, but if doctors think it's necessary, they'll check you into the clinic to be treated with antibiotics. As with any anesthetic procedure, there is the risk of infection or a reaction to the anesthetic, and you will be given a routine antibiotic shot at the time of the anesthetic to combat this risk. We work with professional fertility clinics where you will have the best possible specialized medical treatment. You are in good hands. Let's talk about the side effects. As with any medical procedure, there could be some side effects, of which many donors experience very little or none in this case. The most commonly reported are PMS during the 2 weeks of the hormone treatment, commonly characterized as breast tenderness, abdominal bloating, headaches, or mood swings. Some have put on a kilo or so, which could be temporary, as usual with PMS. There should be minimal bleeding, although some spotting is possible after the retrieval, but you may feel a little bloated and uncomfortable for a few to 24 hours afterwards. Lastly, we'll be in touch as soon as you are chosen. Spend a few moments to consider these questions. Have you done anything lately worth remembering? What do you love most about yourself? How have you helped someone else recently? What have you done in the last year that makes you proud? What's something new you recently learned about yourself? We know that you'll have some real answers after our egg donation program. Thank you again for the time that you have taken to join us on this incredible journey. Use our website, read and ask as many questions as you need to in order to make sure that you are ready for the program, and above all, enjoy.